So I have the pleasure of welcoming the Clinical Director of the University Health Center, Dr. Tina Hylton-Kong, for a discussion on health and the various health services available at the UWI Mona campus. Welcome, Dr. Hylton-Kong.
Thank you, and welcome to your students. Welcome to UWI.
All right, thank you. Thank you so much for agreeing to join us. We're very happy to have you. So I just wanted to start by asking you, what are some of the on-campus health facilities that are available to students at Mona?
Okay, well, here we are at the UWI Health Center, which I'm the clinical director, and the health center is located right on Gibraltar Road, Campway, right across from what they call Social Welfare Training Center. It's important to know where it is because many people don't know where it is. It's a huge campus and many people don't know. I just wanted to say it's a health center for the students, for the staff, for their dependents, for retirees. So it's not for you only, but we do, and a large proportion of the persons we serve are actually students. The campus is located very near to the University Hospital of the West Indies, which is a separate entity, but we refer persons there, and I believe that there is a different rate for the students. But I'm not very au fait with what is actually the UWI hospital services, but we do quite a referral between.
Okay, thank you. So what services are offered at the UWI Health Center?
All right, well, our health center has, you can come in to have screening, say do your blood pressure, do your sugar test or stuff. You can come in to ask questions. You can come in for clinical checkups, you have a clinical medical problem, you can get seen. We also we have a counseling and psychiatry services. So we have the counseling service within the health center. They have their separate sort of organization, but they're within the health center. We have a dental clinic also within the health center too. And yeah, clinical, medical, counseling, right, dental, and of course, how could I forget the pharmacy services? We have a pharmacy that's open to people on campus and people off campus, very reasonable prices.
Okay, nice, nice. So students can take note of that. Yes. How do students access services at the UWI Health Center?
Well, so if it is that someone has an urgent or acute problem, they can pretty much walk in. This time or operation hours are 8:30 to 4:30, Mondays to Fridays. We have not, since COVID, we have not done the after hours or weekend services, and I'm not thinking that we're going to start that very soon. We have limitations. But they can walk in and they will actually be screened. Usually we have 3 doctors there most days, and we would have maybe 1 doctor screening, triaging, whereas we'll have the other 2 seeing the appointments. So you can also call in or send by the email request to have an appointment, and we will set an appointment for, say, non-acute or not so acute. Or if you have been screened by the doctor and they said, okay, we'll see you, but get an appointment. So it's on that basis.
Okay.
We want to develop further, as we get our technology and updates. Yes.
Right, indeed, and we all do, certainly. Does the UWI offer health insurance coverage for students?
Yes, as part of the arrangement as a student, you do get health insurance coverage. Usually it's for about a year or 2 years. All those details you can get from your registration purposes, but the health insurance will cover. Actually, if you come and get seen at the health center, you only just really, once your card is current and your registration is current, you get seen. There's no charge, we just charge on the card. But right. If you go outside to see a doctor, you have to, it's a co-payment.
Okay, understood. I will be sharing more information about the health insurance services that the UWI offers in the chat. Okay. So so we're looking at the UWI medical questionnaire. So the questionnaire that students need in order to come to the UWI. can this be completed by doctors at the health center?
So normally your medical questionnaire is done as part of the application process. So for that answer, how I understand it, the answer would be no. However, we do have situations, especially as the international students, they may have some aspects of the questionnaire that could not be completed from their home country. And so they could come here to get that service. So for example, some persons cannot access, say, the tuberculin skin test for TB, and they can come here and we'll make arrangements. We don't do it here, but we'll make arrangements for them to have it at the university hospital. One of the services that we offer here too is we have a public health nurse part-time who does the vaccination services for our students. So we can offer those services as well. And how could I have forgotten? This is a university and these are young people. You can come here and get your contraceptives, and you can come here and get your, there are lab services here that we have. Unfortunately, it's only 2 days a week at the moment. It's a private lab, so you use your health insurance to get that. That's another service we would really want to soon have, more available on-site, rapid testing. So you could come and say, have your HIV test done or your rapid cholesterol. Those are some things that we want that are in the pipeline. Okay,
fantastic. So students will be grappling with things like depression, anxiety, and stress while they're studying here abroad. What services can they find at the health center that can help to alleviate some of these challenges?
I thought you were talking about me a while, anxiety, stress. So as we know, all of us, students and staff alike, will have these situations and from time to time. And we're very, very cognizant that this is a great need, especially during and the post-COVID time. So we do have that counseling service and a psychiatry service. So we have our own psychiatrists here, and we have a couple of counselors here. Many times the sessions are done telemedicine, online, so that has helped us to really get to be able to see more and so on. Yes, and that's available. In addition, we want to do it even before it gets to the stage of, that amount of stress. So we have organized, we train students, fellow students, what we call a peer support program or PSPs. And those would be students who are like in a particular faculty and or on a particular hall, that could be the first person you could, hey, I have this thing, what do you think, and so on, as to how to manage. And they're trained to do basic counseling support, sort of. And if they also know when to refer, so they can be the sort of liaison to help to get you to have an appointment to see a counselor or the psychiatrist. There is a UWI Helps, UWI and that's a 24-hour hotline for counseling service. So if you're, on hall at 1 a.m., you're missing your home and you're just tired of this country, Jamaica, or whatever, or the students, you can call and they can help to, do the acute counseling and then refer you as needed.
Okay, fantastic. Are there any programs in place to help students manage their physical well-being?
Yes, well, I would say from the health center at the moment, we're pretty much, you come see us. And we used to have that sort of outreach, and there is scope for that. And as I said, we had it before. COVID kind of sort of, disrupted many things. And other issues, the staffing and so on. And so we would not, I don't want to say close that gap, because that's what we really want to do, that sort of outreach, that sort of screening and, go on a hall and that sort of thing, as long as we have that, the timing and the staff to do. So we work pretty closely with the Guild, and the Guild of Students have their different groups, health groups and so on. So they may consult with us. They have a particular project that they would want to do, so to speak, and we can help in that regard.
Okay, thank you. All right. Do students need to be vaccinated?
So as it relates to COVID vaccine, we certainly recommend highly. For classes, as far as I'm aware, I haven't had that. There's no mandatory vaccination. I personally, as a public health doctor, would certainly recommend vaccination. It's not going to prevent these current strains, but it certainly does help the severity. And we have the vaccines available here, usually on campus just down the road from us at the Community Health and Psychiatry. You can get the vaccines, and pretty much right now it's almost walk-in. You don't really have to have an appointment.
Right, indeed. Is a negative COVID test a requirement for moving into a hall of residence?
Not that I'm aware of. In the original earlier days of COVID, yes, but not, no, I don't believe so, no.
Okay, all right, thank you. All right, so I know monkeypox is something that's on a lot of people's minds. What is the UWI's policy on monkeypox? Is there screening for that? How is that handled?
All right, so monkeypox is not at a great threat to Jamaica, shall I say, as yet. And if you are a foreign student, one thing you know about in Jamaica, they'll say knock on wood, which means, you know, just make sure you're saying that so it doesn't happen. But we have had one case reported in Jamaica so far. So we're not, and we don't have screening tests available. So the short answer is no. However, you know, we're always keen to provide the information, if there are questions, to provide the answers. And of course, if anyone wants think that they have, certainly, you know, immediately they could call us and, you know, we could investigate. I would like to just step back a little bit for the COVID, because yes, those dark days of COVID are behind us, but we don't really know what's ahead of us. We do know that we currently have COVID cases, and that we want to try to minimize the, you know, the spread of it. So what we would like for students to do is, as soon as they have noticed anything, itchy throat, sore throat, feverish feeling, you know, the sort of symptoms, a cough, best thing to do, stay in your hall, stay at home, call the health center or call your doctor and let us have a discussion. We do have, at the moment, the COVID antigen test. It's available to students and staff free at the moment because of how we got it. So we encourage you to call and not come in, because we also have to be mindful of the safety of other visitors to the health center as well as our staff. We did have and still have staff coming down with COVID. So we want to protect our staff as well. So it suggests that you call in and we would help to direct you. The doctors do telemedicine calls daily, you know. So it's best to check it out before getting worried or so on. Even, and I want to say, especially maybe, many times we have sort of chronic conditions. And when you notice, like say your sinusitis are acting up or your asthma is acting up, it's a good idea to just call and check it out, because sometimes it is actually COVID or that it needs some medication before it gets worse.
Indeed, indeed. What about the policy on yellow fever? I know there have been questions about that. Is a vaccine required?
So yellow fever vaccination is required for countries that are endemic. Yellow fever is endemic, or if you're going to a country that yellow fever is endemic. So Jamaica is not one of those countries, again, knock on wood, that have cases of yellow fever. If we have a case of yellow fever, it's definitely imported. And, you know, so we don't really have yellow fever, but we would have the need for persons coming from countries that have cases of yellow fever to be vaccinated. So you know, and that you can easily go on like a WHO. I have to actually do that quite a bit. You go on a WHO website and see which countries that, you know, requires the vaccine. But we don't, if you're coming in from, you know, say Europe, USA, so on, you're not really required to have a yellow fever vaccine. It's always good. Anytime you have the offer to get it, it's a good thing to get because you never know your travel, but we won't say stop you from coming in. And the yellow fever vaccination will be at the port of entry in terms of whether they say you need or not. So
Okay.
that I don't really have that control. That is a port authority, port health authority matter. Okay. And we don't have vaccines for that. It's given at, there are two sites that I know, public sites that are allowed by the World Health Organization to give the yellow fever vaccine. It has to be a designated site. So in Kingston, it's the Comprehensive Health Center, and in Montego Bay, it's the Type 5 Health Center.
Okay, thank you.
But certainly we could help to facilitate if someone needed one.
Okay, noted. Okay, just in terms of general advice, what advice would you, give to a student, international or regional student, in managing their mental health while studying abroad?
Well, even that too, that sort of things, I believe there are resources here. They have, presentations from time to time. I know the guild and also even the faculties have that sort of, I would say, to mitigate against it, so, study and Office of the Student Services, study skills and, psychological testing if needed for, learning stuff. So, and advising and so on. So there are other programs to help to detect that. And it can be a stressful time, especially if you're a foreign student, there are other things come into play. You're international students, sorry. If there are other things, you may be missing home, the culture may be different, so there are other things. I think back of my student days in a non-Jamaican country, so you do have that, and there may be other issues too, even personal issues. You may have left behind a loved one back in the country, or missing them, or a baby or so it can be quite a bit. And so any time that any kind of support, as I said, there are different avenues, we do try to address that. And we know that we are quite deficient in the amount of providers that we have for counseling and the psychiatry, but we're making, the university have invested, and so we are trying our best to have that appointment system going and also to do the referral. So there are times when we will refer, not to get rid of you, but to be able to help look and see what is really needed for you and the best plan for you. So we may be working with, say, the Faculty of Social Sciences. They have their psychologists and different services. We may be working with the chaplain services. We may be working with the faculty advising services. So we really try to see what is the best plan going forward.
Okay, excellent. In terms of maintaining a balance, I know students will be confronted with a lot of issues while they're studying here. Are there any specific areas in which you can guide students in terms of maintaining that balance?
Well, that would, you kind of need to sort of try to know what you want, what are your goals, but also to make sure there's that balance between enjoyment, relaxation, studying, keeping up, because a lot of time the anxiety, the stress and so on is because you've probably partied a little bit too much or not really spend the time investing. So it's more preempting it, but enjoying. And at times we can be very hard on ourselves too. So it's important to find that balance and to get help or just advice so that you can, help to negotiate and navigate the best road for you.
Right, indeed, sound advice. Are there any other tips that you would want to share to students before they come to Jamaica? Any health related tips?
I think, I think it's always kind of good to, if you doubt, check it out. Yes, we have worried wells, but that's okay. But we also have persons who are not, um, let's say that health-seeking behavior is not, at the optimum. So as I think it's best to check it out. It's best for us to say it's okay than for us to say, oh, how could you have this so long or so? So I think it's a good idea to have that. And that's why it's so important our health services to be able to be in touch with students. And so whatever liaison arrangement we may have, say with the guild or with, the resident advisors, the SSDMs, that's the head of the halls, we work through that, and they will also be saying to us, hey, they are also looking out to say, okay, for this particular area, we think it would be the best to have, say, a presentation or so on. So I think we have to work together, and don't just remember there's support, but you have to sort of reach out for support if it is needed, and the sooner, the better for you.
Indeed. Dr. Kong, I really can't thank you enough. Really appreciate your taking the time and for your very informative responses. So really, thank you very much.
Okay, and thank you for having me. And we have given the contact details. We know our telephone lines can be so busy. And so we are eager to explore other options and, get with it in terms of Instagram and so on. But in the meantime, if you can and contact us, WhatsApp or so on, we'll try our best to reach out to you too.
Certainly. I will be sharing all your contact details as well. So thank you again.
And thank you. All right. Have fun while you're on campus safely.
Indeed.